Hello. So today I will be presenting Cushing's disease. So Cushing's disease was discovered in 1932 by Harvey W. Cushing. It is a common form of Cushing's syndrome, which Cushing syndrome is the clinical signs and symptoms of evaluated levels of plasma glucocorticoids. There are two forms of Cushing's syndrome. There's exogenous, which is the most common form, and endogenous, which is more rare, but that is what Cushing's disease falls under. So, Cushing's disease is caused by pituitary corticotroph tumors. These tumors overproduce adrenal corticotropic hormone, which then causes an excess secretion of cortisol from the adrenal glands. Approximately 80 to 90% of these tumors are microtumors, meaning that they are less than 10 millimeters in diameter and they are enclosed within the sella turcica, which is a depression in the sphenoid bone at the base of the skull, and it actually houses and protects the pituitary gland. So, Cushing's disease has a prevalence rate of 40 per million and an incidence rate of 1.2 to 2.4 per million per year. Women are also 3 times more likely to be affected than men, and typically the health related quality of life for these patients is typically impaired due to the clinical symptoms and their comorbidities that these patients endure. Usually, it has a negative effect on their mental and physical well being. After treatment, generally their quality of life tends to improve, but but most patients do usually have underlying symptoms that come along with Cushing's disease. So, Cushing's disease can present with common features such as weight gain, depression, mood changes, difficulty sleeping, new or worsening diabetes or hypertension. So, like I mentioned in the previous slide, a lot of the time patients will still have other issues that they're dealing with, such as diabetes or hypertension, even after their tumors are removed or they've dealt with the Cushing's disease. Patients may have physical changes, such as changes in their facial features, such as rounding. And in children, there's typically a decrease in growth velocity and a delay in puberty. So, like I mentioned in the previous slide, weight gain and facial changes do tend to happen. So, there is a visceral fat deposition is probably one of the most common symptoms in patients. Patients will develop moon face, which is a fat distribution in the face, and buffalo hump, which is a fat distribution within their kind of like behind their neck. Usually, this will resolve on its own after normalizing the cortisol levels, but it can be something that's also seen in patients with simple obesity, which is kind of like a differential diagnosis that you would want to rule out when treating patients with Cushing's disease. So, when to test for Cushing's disease? So, it's recommended for patients with features of hypercortisolism, usually if they have unusual features for their age or unusual other issues for their age, such as osteoporosis or hypertension. With children that are decreasing in height and increasing in weight percentiles, and patients with underlying adrenal tumors as well. Biochemical testing is the initially for Cushing syndrome. It can be used to help diagnose patients with Cushing's disease. There are a couple of different tests that can be run, such as a 24-hour urinary free cortisol test, a late night salivary cortisol test, an overnight dexamethasone suppression test, and then a longer low dose dexamethasone suppression test. Values of serum cortisol can present higher in women with higher estrogen levels. This can be seen in women taking like an oral contraceptive pill or pregnant women as well. Treatment for Cushing's disease usually consists of either medication or surgery. For patients with surgery contraindications, typically patients with persistent or recurrent Cushing's disease, you would typically use medications, and these medications would include tumor-directed drugs, adrenal steroidogenesis inhibitors, and glucocorticoid receptive antagonists. Excuse me. Surgical treatments for patients with Cushing disease typically involves removing the tumor. However, these tumors can invade surrounding structures as well. So removing the tumor as well as the invaded surrounding dural structures can help achieve endocrine remission for these patients, and has been shown to have significant remission in these patients as well. In conclusion, Cushing's disease is the outcome of pituitary corticotroph tumors formed by the overproduction of ACTH. The quality of life can be significantly impaired in patients with Cushing's disease due to the clinical symptoms and comorbidities in these patients. Treatment generally includes surgery to remove the tumor that is causing the problem, and medication for patients that have surgical contraindications. Cushing's disease has an associated remission rate of 60 to 90% in patients that surgically remove the affected tumor. And then these are my references. Thank you.